Hello, thank you for joining me. My name is Sloan Kelly, and today I will be discussing Nigeria's tuberculosis gap. Throughout this presentation, you will be presented with multiple choice questions to test your knowledge on the issue. I will give you a couple of seconds to read and consider your answer for each question. To begin, consider this question. Tuberculosis is a blank and blank disease. A. Curable, harmless. B. Curable, fatal. C. Incurable, harmless. D. Incurable, fatal. All right, let's dive in. Tuberculosis, or TB, is the second leading communicable disease responsible for global deaths. Approximately 2 million people die from TB every year. Tuberculosis is a bacterial disease that easily spreads through infectious particles that thrive in the air and are then inhaled by susceptible individuals. This disease normally affects the lungs. While TB can be treated with the use of FDA-approved drugs for a period of 6 to 9 months, it is imperative that the infection is treated early and the anti-TB agents are taken for the full length of time. As of 2020, Nigeria has one of the world's highest incidence rates of TB. Over the past decade, TB's burden of disease has heavily increased in Nigeria, while diagnostic services have remained the same. As a result, a gap has formed between active and diagnosed cases. As the gap increases, the incidence of TB will increase, resulting in more death throughout the country. I chose this issue due to my interest in the healthcare field. Human diseases have always fascinated me, especially those that have caused epidemics in the past. When I came across the tuberculosis epidemic that is still happening in Nigeria, I wanted to dive deeper into the issue. The more I read, the more I wanted to think about strategies and methods to potentially solve the issue. For the purpose of this paper, I chose to write to Nigerian policymakers. The hub of this issue seems to fall on the government's shoulders, therefore I thought it important to address them in this paper. Here we have question 2. What is the incidence of tuberculosis in Nigeria? 103 for every 100,000 people. B. 156 for every 100,000 people. C. 198 for every 100,000 people. Or D. 219 for every 100,000 people. And next, what percentage of the Nigerian population has TB treatment coverage? A. 13%, B. 19%, C. 27%, or D. 35%. All right, let's dive in. According to the World Health Organization's 2019 tuberculosis profile of Nigeria, the total incidence of TB in Nigeria was estimated to be 440,000, or 219 people for every 100,000 individuals in the population. Of these cases, men and women aged 25 to 44 are most affected, with the prevalence being slightly higher in the male population. However, only 27% of those diagnosed with TB have treatment coverage, and 71% of those who sought treatment accrued massive financial costs as a result. Additionally, only approximately 120,000 cases of TB were reported to government authorities, suggesting that over 300,000 cases of TB in Nigeria went undiagnosed and untreated in 2019. This number in particular is very indicative of the growing gap between active and diagnosed cases. From these numbers, we can see that TB has become a major issue in Nigeria. Further, it is estimated that approximately 30,000 Nigerian children are infected by TB every year. While 47,000 children have the opportunity to receive preventative TB treatment, only 8,500 children actually receive the preventative care. In order to achieve one of the United Nations Sustainable Development Goals, number 3, pertaining to good health and well-being, action must be taken to combat the Nigerian tuberculosis epidemic. Now, The TB gap in Nigeria didn't happen overnight. Let's dive into the root causes of the issue. But before we do, let's look at this question. All of the following are factors contributing to the issue except A. Public health awareness or education, B. Lack of medical services, C. Cultural beliefs, D. Government non-engagement. Moving on. Question 5. The Nigerian government contributed 100% of its GDP allocated towards TB control. A. True. B. False. C. The Nigerian government does not have money allocated towards TB control. To begin, the majority of the Nigerian population is not seeking necessary TB treatment due to a lack of public health awareness efforts. TB education is not integrated into the general healthcare setting, and there are few public resources available for consumption. A 2004 study that examined patient presentation habits in Lagos, Nigeria, concluded that patients don't present early to medical centers and are therefore points of transmission within the population. Awareness of TB's signs and symptoms encourages the initiation of necessary medical treatment early after infection. Additionally, the Nigerian population regards tuberculosis as a spiritual illness that can only be cured by prayer and other religious practices. Instead of seeking clinical treatment for TB, individuals are turning to their religious leaders for healing. Without proper medical treatment, TB cannot be effectively addressed, and infected individuals continue to communicate the disease. Lastly, there is little government involvement in the prevention and maintenance of tuberculosis within the Nigerian population. Current governmental infrastructure and legislation does not account for the growing incidence of tuberculosis within Nigeria. Instead, TB is allowed to run rampant within the population. The Nigerian government has yet to fully step in to solve the issue. Without strict legislation and enforcement regarding testing, treatment plans, and education efforts, the spread of TB remains uninhibited. So what is being done to solve the issue? In 2018, the Nigerian government contributed only 4% out of a possible 15% of its GDP towards TB commitment. While the Nigerian government is planning to increase this spending, these funds are being put towards diagnostic tools that do not efficiently diagnose all forms of TB. With unreliable diagnostic equipment, patients may be provided an ineffective treatment plan, and its futility goes unnoticed. Additionally, global awareness of the issue is continuing to increase, calling for further research and action to solve the TB gap in Nigeria. So what still needs to be done to solve this issue? Tuberculosis control programs need legislation in order to strengthen their presence within low-resource and high TB burden areas. Currently, there is a weak TB surveillance system, delay in diagnosis and treatment initiation, and little infection control measures present within Nigerian healthcare. Legislation that encourages and demands appropriate action and care is one of the only solutions to Nigeria's growing tuberculosis epidemic. Additionally, TB control needs to be integrated into the delivery of general health services. Utilizing this far-reaching branch of health providers to educate families, provide preventative treatment to children, and increase national awareness will have widespread communal efforts. Community government collaboration is one potential option to increase the recognition of and treatment response to TB. A study conducted in the Pacific island of Vanuatu concluded that local healers who treat spiritual illnesses such as TB expressed a willingness to collaborate with the governmental healthcare system in order to combat the spread of the disease. Similar to Vanuatu, Nigerian culture deems tuberculosis a spiritual illness. Nigerian healers and spiritual leaders are called upon by the population to treat these conditions. This collaborative approach between community members and governmental leaders could be evaluated for use within Nigeria. Strengthening tuberculosis control programs through legislation has the potential to increase TB education efforts. Educating the population to recognize the signs and symptoms of tuberculosis, as well as how to prevent the spread of infection, is crucial to decreasing the prevalence and incidence of TB. Legislation aimed at strengthening a TB surveillance system, increasing infection control measures, encouraging TB diagnostic efforts, and integrating TB education into primary care settings has the potential to quicken the initiation of care. Once these programs are strengthened with governmental enforcement, tuberculosis awareness can increase, and treatment efforts by patients and providers can surge. To increase tuberculosis control within communities, it is imperative to adopt a community-based participatory research model in order to identify the best course of action for slowing the spread of TB. If the community is not involved, any efforts put in place by government bodies or outside international organizations may be effective for a limited time only. After organizations leave or enforcement becomes relaxed, the efforts put in place may no longer be effective. Involving Nigerian community members to educate the population concerning signs, symptoms, and infection control ensures an effective approach to proper TB prevention. Collaborating with respected community members, such as healers, who come face to face with tuberculosis daily, could increase the early presentation of TB. Upon earlier detection of the infection, the more likely treatment efforts will successfully decrease the incidence of TB in Nigeria. By writing this paper, I learned how important it is to organize your findings before you start to write. If you are unorganized, the overall flow and meaning of your writing is lost. Secondly, I learned how efficient it is to start with small drafts and work up to a larger draft of your writing. Doing this can help with meaning and flow. You can go back and see where you need improvement or where you need to scale down your writing. Lastly, this paper has shown me how important it is to delve into important global health topics. It is very easy to think that someone else is doing it, therefore you don't need to. However, you could be the only person truly invested in a certain issue that needs to be globally addressed. Don't be afraid to stand up for others who can't. Here are the answers to the multiple choice questions within the presentation. If you missed any of these, I hope the presentation provided you with the knowledge to answer them correctly. To finish, I will ask you to consider this discussion question. What can non-policy makers do to help strengthen TB control in Nigeria? Here are references. I hope you enjoyed the presentation.